Hello everyone. Now let's discuss about the cardiac axis. So what is cardiac axis? It is the average direction of the spread of the depolarization wave through the ventricles, okay, as seen from the front view. So important one is the average direction as seen from the front view. So shape of the QRS complex is actually determines the average direction, whether it is towards the left ventricle or predominantly towards the right ventricle. The shape will describe the average direction, which I'll discuss in detail later. So first, if a lead is there and the direction of the axis is towards the lead, it gives a predominantly positive deflection. Okay, so if the deflection depolarization wave is away from the lead, then it gives a predominantly negative deflection. And if the the depolarization wave is perpendicular to the lead, it gives equiphasic type of reflection, that is R is equal to S. In negative deflection, R is less than X, and in positive deflection, R is greater than S. Okay, so now let's know about the cardiac axis and the lead angle. So if we take this as a cardiac axis, just remember 0 degree plus 180 plus 90 minus 90 minus 30 plus 60 and plus 120 and minus 150. So lead 1 is at 0 degrees and lead AVF is plus 90 degree, and lead 2 is plus 60 and lead AVL is minus 30, whereas lead 3 is plus 120 and lead AVR is minus 150. So we have to know about the perpendicular leads. This diagram you all have to practice, which is very important. You just have to by heart this. Okay, so first we should know about the perpendicular leads. Here in cardiac axis we take only chest leads into limb leads into consideration, and we won't take any chest leads. Okay, so we have to look for the perpendicular leads first. In perpendicular leads, if lead 1 as we can see here at 0 degree, so perpendicular lead is at plus 90 degree, that is AVF. Okay, so for the second lead, the perpendicular lead is AVL, 0 plus 60 and minus 30. For lead 3, perpendicular lead is AVR. This is very important in cardiac axis calculation, so you have to by heart this thing. Lead 1 perpendicular is AVF, lead 2 is AVL, lead 3 is AVR. So this is the cardiac axis, right? The normal axis is usually between AVF and AVL, that is the normal axis is minus 30 to plus 90 degree. Okay, the red part is usually indicates left axis deviation, that is minus 30 to minus 90 degree. So the blue dots indicates right axis deviation, that is from plus 90 to minus 150 degree. The purple one indicates extreme axis or extreme left axis deviation, that is also called as northwest axis deviation, that is usually from minus 150 to minus 90 degree. So this thing you all have to remember. Based on cardiac axis that we calculate in further parts, we have to know which side the axis is deviated. Based on that we can determine the cause behind based on the ECG itself. Okay, so now cardiac axis determination. So various methods are there. There are 3 methods I'll be discussing now. The first one, which is the most accurate one, it is also called the equiphasic method or isoelectric method. Okay, so we have to first identify the equiphasic lead. That, as I said, equiphasic lead is the one where R is equal to S. The direction of the depolarization wave will be perpendicular to that particular lead. Okay, so we have found out an equiphasic lead. Then we have to look for the lead which is perpendicular to the equiphasic lead. Okay, and we have found out the lead which is perpendicular to it, and we have to see the direction of QRS complex in that, whether it is predominantly positive or predominantly negative. These 3 things we have to look at. See now look at the leads. So now here the equiphasic lead is AVL, right? Because here R is equal to S, right? So the AVL is there, which is the lead perpendicular to AVL, that is lead 2. Look at lead 2 now. Lead 2 is perpendicularly in positive direction, right? So the direction is towards the lead 2, so it lies in the normal axis. Okay, so we'll see another example now. Here in this ECG the equiphasic lead is lead 2, right? So again it is the lead 2. So the lead perpendicular is AVL. Look at AVL. AVL is predominantly negative, so it goes away from AVL, so it comes towards the right axis range. So this ECG has right axis deviation. Okay, so another one now. Here it is the perpendicular lead is AVR, right? So AVR we took, and perpendicular to the AVR is lead 3. Look at lead 3 now. Lead 3 here is predominantly negative, right? So it has left axis deviation. So we saw all the three: normal axis, right axis, and left axis deviation. So in equiphasic method, look at the lead which is equiphasic, that is where R equal to S wave, and then determine the lead which is perpendicular to it and see that lead whether it is positive or negative. If you just remember this diagram, it will be easy for you to determine. Okay, so the next method is quadrant approach. It gives a gross cardiac axis values which is less accurate than the equiphasic methods. Okay, so here we look at only two leads, that is lead 1 and AVF. Okay, there we used to look at all the leads, look for the equiphasic one, but here it is only the two leads we have to look at, that is 1 and AVF. Okay, so here we are seeing at 1 and AVF. So in lead 1 and AVF, based on the deflections, if both the leads are positive, predominant positive, one is positive, AVF is also positive, so it comes in normal axis. If one is negative, predominantly negative, and AVF is predominantly positive, it comes under right axis deviation, right? So if one is predominantly positive and AVF is predominantly negative, it comes in the left axis deviation range. Okay, so this is the one. See here in the lower normal one, one is positive, AVF is positive, it comes under normal axis. Then one is negative, AVF is also negative, one is positive, AVF is negative, so it comes in left axis deviation range. If one is negative and AVF is also negative, it comes in right axis deviation range, extreme right axis. And the down purple one is, if one is negative and AVF is positive, it comes under right axis deviation. Okay, so this is the quadrantic approach, which is easier method. Just look at two leads, that is 1 and AVF, you will see in which direction it falls. Okay, so one disadvantage is in left axis deviation, as I said before, up to minus 30 degree it is normal axis, right? Minus 30 to plus 90 degrees. So this quadrantic approach includes the normal part also. 0 to minus 30 also comes under LAD in this quadrantic approach. So that is a disadvantage of this. So equiphasic method is a preferred one. So here look at the one is positive, right? So towards the positive lead, then look at AVF. AVF is also positive, so it is normal one, right? So next method is rule of thumb method. This is very easy method. You have to look at only lead 1 and lead 3. Just remember. Okay, so quadrantic approach is 1 and AVF, whereas the rule of thumb method is 1 and lead 3. Lead 1 and lead 3 you look at. Okay, so very mnemonic is there, that is left reaches and right reaches and left leaves. Okay, so this mnemonic you have to remember. In lead 1 and lead 3 if you look at, normally both will be positive. Okay, whereas if one is negative and lead 3 is positive, they are reaching each other, right? They are going towards each other, so it is right axis deviation. Right axis deviation, lead 1 and lead 3 waves reach each other. So if lead 1 is positive and lead 3 is negative, they are leaving each other. QRS complexes are going away from each other, leaving each other, so it is left axis deviation. So here in this ECG I will discuss about all the rules. See, thumb rule. Here we have to look at lead 1 and lead 3, right? So lead 1 is predominantly negative, whereas lead 3 is positive. They are reaching each other, right? So it has right axis deviation. Next one, quadrantic approach. Quadrantic approach, if we do, we have to look at lead 1 and AVF, right? So lead 1 is predominantly negative, so it goes towards away from the lead 1, and AVF is positive, it is coming. So here also it is right axis deviation, right? Okay, so next method is biphasic or equiphasic method. So biphasic lead is lead 2 here, right? So perpendicular to lead 2 will be AVL. So EVL is negative. So negative means it away from AVL lead. So it comes in the right axis deviation range itself. Okay. So this is how all the three methods we have applied here. You can follow whichever is easy. On the bedside you can either go for quadratic approach or rule of thumb directly to see if there is right or left axis deviation. Okay, which will be easier method. So these are the causes of axis deviation. Left axis deviation mainly LVH, left bundle branch block, inferior wall MI, Wolff-Parkinson-White syndrome. Okay, less common causes are ventricular pacing or ectopy, primum type of ASD, and left anterior fascicular block, and horizontally oriented heart in short and squat patient. Extreme axis deviation in ventricular rhythms like VT, AIVR or ventricular ectopy, and hyperkalemia and severe right ventricular hypertrophy also. Okay, so causes of right axis deviation are RVH, chronic lung disease like COPD, hyperkalemia, renal insufficiency and potassium retention, dextrocardia, Wolff-Parkinson-White syndrome, ventricular ectopies. Other less common causes are sodium channel blockade by TCA poisonings, acute RV strain, lateral STEMI, secondum type of ASD, normal pediatric ECGs, left posterior fascicular block. Anterior fascicular block is left axis deviation, posterior fascicular block is left axis deviation. Okay, posterior fascicular block is right axis deviation. And in case of vertically oriented heart in patient, in case of tall and thin patients. Okay, thank you.